AskReddit. Doctors of Reddit. What is a 1 in a million chance thing about your patient you have witnessed? Was operating on a pregnant lady that came in having been shot in the belly. OB delivered the kid through our incision and the baby had a perfect line across his shoulder where the bullet had grazed him. He was totally fine and didn't need stitches. Mom lived too. My father is an anesthetist. I remember his 1 in a million way more rare actually. Thing happened when I was like 13. He was knocking a patient out for the surgery. Did the pre-op stuff. The woman's consultation earlier showed no flags for anything major. She had a reaction, which can happen such as malignant hypothermia, but this wasn't that. Her reaction to the medication was where her own skin started to split and peel away from her body in large chunks. Her own body was rejecting her skin. The woman spent quite some time recovering. There was an investigation into the whole thing. But everything was done by the book and there was no reason for this to happen. The drug company was contacted and they had never heard or seen about this happening with any of the drugs. Drugs were taken and retested. This went on for a while. Turns out it was an allergic reaction to the drug and it's just the way it presented. It was so extremely rare no one had seen it with the drug that has been in use for decades all over the world. My father ended up writing a paper on it. Edit. We'll see if the paper is online or get the info on the journal it was published in. Was almost 20 years ago. This is a true moment straight out of House MD. It both illustrates how dumb luck can determine whether we live or die and how well trained and observant some professionals are. A neurologist I was rotating with once was walking to the parking lot through the emergency department and one of the docs stopped him and asked him to do a quick look-see on a lady he was about to discharge home. We called these drive-by consults. This woman had some vague, non-specific complaints like headache and passing dizziness but nothing out of the ordinary and all tests in the ER came back negative so she was waiting for discharge. Neurologist spends 5 minutes with her, comes back and says admit this woman and do a stat MRI of her brain. He noticed an extremely subtle vertical nystagmus of her eyes. A nystagmus is basically a repetitive, uncontrolled movement of your eyes which can have dozens of causes. A horizontal nystagmus is what you'll see 99.9% of the time and it's usually benign in origin. Vertical nystagmus, on the other hand, is a stroke in your cerebellum until proven otherwise. They sent the woman to MRI which showed infarcts in both sides of her cerebellum and she was in neurosurgery the next morning. If it weren't for that drive-by she would have been sent home and probably died overnight. Edit. I was not expecting this comment chain to get so large. A few people have pointed out that if she had surgery the next day and could have died overnight, why did she not pass away at the hospital? Answer is that non-surgical treatment also began as soon as she was admitted. One of my patients nearly died from an amniotic embolism while she was in labor. It's so rare that the only way to diagnose it is by ruling pretty much everything else out first. It's essentially when the amniotic fluid accidentally passes into the mum's bloodstream. She had a cardiac arrest and we did CPR while doing an emergency C-section. She is slowly recovering but has lost most of her brain function. Inserted a urinary catheter to a female patient. She complains of pain where the bladder is situated, and it was distended. No drainage per catheter. When we pulled the catheter out, there it was, a worm which got stuck inside the tube. How the hell did the worm enter the bladder? I was a paramedic and I came to a scene where I had a patient who was talking to me, but he had no blood pressure and no detectable pulse. I couldn't even hear his heartbeat with a high quality stethoscope. They dumped a few bags of fluid in him in the ED before they were barely able to get a BP on him. Had a very sick child with influenza. Spent 6 months in my ICU. Had a month of blood gases that were not compatible with life. Had multiple collapsed lungs. He's currently in 6th grade, no ventilator, no tracheostomy, literally no complications for the long term. This was years ago. Saw a teenager, 16 or 17, have a heart attack. Jacked athletic kid with 8-pack abs fell on the ground clutching his chest during basketball practice. Everyone in the pediatric thought it was a panic attack except for the adult resident who said, "I've seen hundreds of heart attacks. He's having a heart attack. Don't ask me why, but that's what this looks like." And that's what it was. He had an inborn anomaly where one of coronary arteries coursed between the pulmonary artery and the aorta. During exercise, the aorta and pulmonary artery expand with the increased cardiac output, and for whatever reason, that was the day that they squeezed a right coronary artery and caused a massive myocardial infarction. It was bad news bears. The damage was so bad, kid needed a heart transplant. He was transferred to a pediatric heart center. A left ventricular assist device, LVAD, was implanted because his heart function was so poor. A donor heart was found, and as he was being prepared for surgery, his own heart decided to suddenly start working again. It turns out that hearts can heal after a massive heart attack, especially teenage hearts and ripped, athletic kids with 8-pack abs. This was only discovered after the advent of the LVAD because prior to that, nobody would live long enough to recover. At the time, I think this kid was like one of the first 10 pediatric patients to get an LVAD at that hospital. So the kid had to get his coronary artery reimplanted so that it wasn't going to get squeezed like that again, but he got to keep his heart, and I hear he recovered and returned to playing basketball. I spayed and neutered a hermaphrodite pit bull once. Story from last year. After a pretty uneventful pregnancy, a woman goes into labor but it doesn't advance as quickly as it should, so she gets a secondary cesarean section. Standard procedure. The baby gets out and its eyeball is almost pressed out of the eye socket. Everybody is in shock. The parents start crying. We don't know what to do. Turns out the child had a huge tumor of the temporal lobe which pushed the eye out. We later analyzed the ultrasound pics and the tumor was already there, so it just got overlooked. Brain tumors in neonates are even rarer than 1 in a million. It's actually 0.3 per million, so I hope I'll never see such a case again. Edit. Unfortunately, I don't know the outcome. The child was transferred to another hospital. I once saw an IV drug user who managed to break an old needle off in his vein when injecting and presented with chest pain. It was only when we were doing an angiogram we noticed the needle fragment embedded in his heart. I've never seen this before or since. TLDR. Needle inside the heart in a drug user. Couldn't get it out. Bad situation. I once saw a newborn baby who was a true mix of genders, intersex. I was part of the meeting with the top pediatricians discussing the case. The patient's gender was clinically indeterminate from external genitalia. MRI showed one ovary and half a uterus on one side and a partially descended testicle on the other side. To decide once and for all, they used genetic analysis to analyze the chromosome makeup. However, this showed a 50-50 mosaic of cells, some of which were XX, female, and some of which were XY, male. A very confusing case as to what to do next. Unfortunately, I was unable to follow this one up. My dad somehow got a blood infection that, normally, only dogs can get. Is your dad a good boy? The best boy. He got lots of treats after. My mother, now retired, was a GP in the middle of nowhere, in southwest France. In the early 90s, she had her first HIV cases. With the med at the time, they did not last long. Except one. Clearly HIV, but not developing AIDS at all. He was one of the few people with natural immunity. Had a patient come in with headaches and she was a young woman. Her entire body would go numb with these headaches. Got a CT. She has 3 separate tumors in her brain. My aunt and uncle-in-law are both doctors. Once, she was lying on his stomach and she heard something odd in his pulse blood flow. Went to the hospital that night and he had surgery to resolve and blockage, which if it had ruptured he would have been dead in 10 minutes. All by pure chance. I would say I have seen 2 cases of this. The first one was a dude who got stabbed in the chest. He arrived at the ER and had the knife moving with his heartbeat, but he was actually stable. In pain but stable. We got him to the ER, and to my surprise the knife went into the heart. It was about 1mm from going into the inner cavities. So he was saved by 1mm from probably dying. X-ray. The second one was a young man who got shot in the back. He came in the ER with pain but very stable. He went to a CT scan, and the image was just incredible. It's not simple to explain without an image or if you're not used to seeing CT scans, but the bullet went in through his back, missed the right kidney, liver, the spine, and ended between his aorta and cava. It was just the perfect trajectory to miss everything. 1mm in every direction could have been fatal. I couldn't believe that shit had happened. I'm a vet. It wasn't the patient so much as the owners. A dog was brought in because it was giving birth. The only thing was that it was male. The woman, late 30, was screaming that she sees the head. In reality those were his testicles. In the end I had to sit and explain to her about the birds and the bees. I'm not a doctor but an RN. Before I was an RN, I was a patient care technician in the emergency department. I often worked closely with a specific doctor. She had a habit of thinking that there was always more to symptoms than there were, so no one ever took her seriously when she went digging. She especially paid close attention to pediatric patients and ordered way more tests than any of the other ED physicians would have. There was a 12-year-old boy whose parents brought him in for suicidal and homicidal ideation. The child talked about how he hated himself, wanted to die, suddenly hated his parents and siblings and often thought of hurting them. He had no history before this of being mentally ill, and it happened very suddenly. Within a week his personality changed. His parents were absolutely certain that it was just him being a preteen, hormonal and unstable. All the things he described were typical of a depressed and mentally disturbed preteen, and none of us thought anything otherwise. We assumed he was suffering from mental illness. However, when the doctor spoke to him, he vaguely mentioned having frequent headaches and getting dizzy a lot. He and his parents also talked about how he had started complaining of nausea and would sometimes vomit for no apparent reason. She thought that he may have something organic and not just mental going on. She got a CT on his brain. I remember the nurses saying she was overreacting and that the kid should just have a psych consultant be hospitalized. I very distinctly remember people complaining about doing more work than necessary on this child who was obviously just mentally disturbed. It turns out, the kid actually had an atypical teratoid rhabdoid tumor, ATRT, which is incredibly rare, less than 1% of childhood brain tumors. The tumor had been there long enough to spread to his frontal lobe. On further questioning after he was diagnosed with the ATRT, the child had been complaining of dizziness, vomiting and headaches long before the personality changes, but it was attributed to him being overweight and having ADHD. It's honestly amazing that the child lived long enough with this tumor for it to spread so far, as it's such an aggressive tumor and generally, children don't live long with them, especially if they're growing at that rate. It's a rare brain tumor, and even more rare that a patient lives long enough for it to spread and cause personality changes. I will never forget that a doctor always looked further into things than people thought necessary. If any other doctor had been on that day, the kid would have been referred to psych, hospitalized in a psych institute and dead in weeks without his parents knowing it was all due to a tumor until after an autopsy. After a neuroconsult, he was shipped to Boston's Children for his brain surgery, one of the top places in the US for pediatric neurosurgeries, and he is alive to this day. He has to have therapies to help him learn how to live normally again, but if it weren't for that specific doctor being on, he'd be dead right now. Eventually, he will live a normal and long, healthy life. That really taught me to respect a doctor's knowledge more, especially if it seems like their intentions are good. Trust the physicians you work with and trust that they are ordering those extra tests not just to save their own asses, but because they want to save lives and are concerned about their patients. I put the catheter in, got explosive diarrhea all over scrubs. Catheter goes in, it comes out. Can't explain that. I'm a nurse, and this happened at the hospital I work at, in the car park. A staff member got out his car and it started rolling. He reached in to pull the handbrake. From where I was sitting in my car, I didn't notice anything other than the car move, and the guy jumped back in his car. A few minutes later, a lady walks by and starts screaming. Turns out he had been pinned half inside his car by his car door, as his car had rolled towards the car next to him. He was unconscious, blue, not breathing. A bunch of us tried breaking into the car next to him to move it, and eventually when there was about 20 of us we actually managed to push his car back enough for PPL to pull him out. Luckily this happened at a hospital, so the crash team had already been called. They did CPR. He lived. Medical student here. Had a 13-year-old who presented to our service with a heart attack. After we worked him up, it turns out when he was a toddler he had unidentified Kawasaki's diseases that went untreated. One of the complications is coronary artery aneurysm, which in his case clotted over and caused the heart attack. Overall, he got better but has to be on blood thinners for the rest of his life. Edit. Since people seem to be confused about the timeline, he had Kawasaki's when he was a toddler and spent a week in the hospital with a fever of unknown origin which wasn't diagnosed, and he got better on his own. We saw him 10 years later when he came to our ED with a heart attack. Seen a patient whose triglycerides were so high that it gave him pancreatitis. They talk about it in the textbooks, but it is extremely rare. It was due to a combination of causes, including drugs he was taking for HIV. Now the crazy thing was when we drew blood it actually separated and there was a supernatant of fat that you could see in the vial. Husband is a doctor and one night came home with a surreal look on his face. He had been seeing a patient for a bit and noticed that although in his mid-20s, had few signs he went through puberty. The patient didn't mind his state all too much, but my husband believes that medicine should improve your life, not just keep it going. So, on a shot in the dark hunch to simply improve a patient's life, my husband sent him for an MRI. The patient had a previously benign and now malignant brain tumor suppressing the part of the brain that controls puberty. The shot in the dark effort to see why the patient hadn't gone through puberty by late 20s led to a very early brain tumor detection. As a family doctor and still a resident, he couldn't believe how much a hunch made a difference one person's life.